Now, let's move to this story. Health officials have been warning for some time now of a possible second wave of COVID-19 infections here in South Africa. Last week, our Health Minister, Zweli Mkhize, who himself is recovering from COVID-19, said he was concerned at a 9% increase in coronavirus cases across the country. KwaZulu-Natal Premier Sihle Zikalala has also warned of another possible lockdown if irresponsible behaviour continues. It would seem that many of us have become a little bit relaxed when it comes to wearing our masks and adhering to social distancing. But why do we do this when we know how dangerous this disease can be? And to discuss this, I'm joined by clinical psychologist Dr Sherona Rawat. Good evening, Dr. Rawat. Thank you very much for your time. We know that this is a very risky disease, particularly for people who are elderly or who have comorbidities. We've heard the messages time and time again. And now it seems that we've moved to level 1 and we think that it's all over. Rationally, we know it's not, but emotionally, it seems there's something going on. Why are we not doing what we know we should?
I think, when we're looking at human nature and we're looking at individuals, we're looking at people that kind of are used to a routine, used to structure, used to a certain way of living. And some months ago when all this started, everything kind of just fell apart. And I think, people are still kind of wanting to get back to their old lives. And as the lockdown comes down, I think they start feeling as if the lockdown equates to the risk factor. And if the lockdown is down to lockdown 1, then the risk factor is down. And I think that's the misconception that is actually going around at the moment. And I think individuals are not really realizing that the risk is still there, that government is telling us what to do in relation to managing the condition, but also in relation to managing the economy and other aspects of running a country. And I think when it comes to the illness, a lot of the responsibility is now falling on the individuals to actually take a bit of charge of their own lives and start actually managing and monitoring what they are doing in order to reduce their risk. And individuals became so used to actually being told by the government, we're in lockdown 5, we're in lockdown 4, and you've got to do this and this and this. And I think they're just so used to being just told what to do that I think now at this time when it's lockdown 1, that same kind of mentality is playing on, and individuals are just forgetting about the COVID-19 and forgetting about the effects and forgetting about the risks that it actually carries. And I think they actually just come to a stage where people are just thinking, what will be, and are actually just being a little bit, I would say, flippant in essence, and hence the dropping of the masks.
Do you think that it's human nature to, over time, get used to danger, to minimize risk? Because the first time we all heard about COVID-19, there was so much that was unknown. We were quite terrified, but now we've lived with it for over 6 months. Do you think we're kind of assimilating it into our reality and therefore just kind of minimizing the dangers somehow? Is that part of how human nature works?
Absolutely, absolutely. I think that, people have been given the kind of impression that the social distancing and wearing of the mask kind of just reduces your risk actually to like almost zero. And they're not actually looking at other activities they're doing, other stuff that they're doing, interacting with different people, kind of mixing with others, going to work, doing all those things, which are actually exposing them to a huge number of individuals. And I think people need to actually realize that the wearing of the mask, I think in essence sometimes it feels as if the wearing of the mask has become a little bit of a fashion statement. And I think people are kind of losing focus of the fact that the mask actually has a purpose. And I think also the kind of mask is also important, because that's another thing that I think was played down a little bit as to, what kind of protection you're actually getting from the masks that you are using. So I think, those aspects need to be highlighted a little bit more at this time.
Do we
and
need...
as I said, you know.
Yeah, I mean, you know, you mentioned that do we need the president to kind of shout at us like naughty kids before we start wearing our masks again? You know, we are expecting to hear from the president, probably not tonight, but at least some stage this week, because we are concerned about a second wave. Do you think that that's how we are? Is that just the way human beings are, that we will only really respond if we get told we're being bad and we need to pull up our socks?
You know, sadly, that is kind of the case most of the time. If we look at society and we look at social norms and we look at our lifestyles, people are so used to, for example, going to work and being told by a boss what to do and how to do it. They've been told what time to come to work, what time to go back home, what time is lunchtime. People are so used to being told what to do and to take instruction that when they are left to their own accord, it appears as if it's like a little naughty child running free, you know, with nobody supervising them. It's sad to say.
And I think
you find a lot of people that have...
Yeah, and
yes.
I think also that as we see other people breaking the rules, it becomes more acceptable for us to break the rules. So there's definitely an element of the crowd and us following what everyone else does. Thank you so much for your insights this evening. It's certainly something we need to think about very, very clearly.